Let's get the latest from across the world on the coronavirus pandemic. And France has overtaken Spain in the number of coronavirus deaths it's recorded, making it the world's fourth worst affected country, behind the US, Russia and the UK. The news comes as schools reopen today with strict social distancing measures in place. The latest daily toll of 348 deaths took the total to nearly 27,000. Well, let's move to Russia, which now has the second highest number of cases of coronavirus after the US. Latest figures show more than 230,000 people have tested positive and more than 2,000 have died. However, some analysts say hundreds of excess deaths remain unexplained. President Putin's spokesperson, the BBC's Sarah Rainsford, is in Moscow with the latest.
Well, Dmitry Peskov has confirmed that he does have coronavirus and he is being treated in hospital, as is his wife, Tatyana Navka, who's given a little more detail. She says that Mr Peskov got sick first, her husband got ill first, and she suggested that it was him who brought the illness back from work, as she put it. As I say, they're both being treated in hospital. Ms. Navka has said that they're both okay. She says she's coming out of it, but that Dmitry Peskov is also okay. Now, he has also clarified that it's been some weeks since he's been personally in direct contact with President Putin. So the chances of him passing it on to Mr Putin are non-existent, as far as we understand. But certainly it's interesting, of course, Vladimir Putin has been out of public contact for some weeks now. He's been working from his residence outside Moscow, holding video conference calls with all his ministers and regional governors, very much staying away from contact and possible infection. Dmitry Peskov, on the other hand, appears to have come into contact with someone somehow, but we don't know what exactly happened, how he got infected.
Well, we're staying in Russia because despite the spiking cases, millions of construction, farming and factory workers are returning to work as restrictions are lifted. Here's Sarah again.
Well, it's interesting, you know, for weeks we've been hearing questions and answers about when Russia will reach the peak in terms of infection rates, when the number of cases will plateau, but we don't hear that anymore. Instead, Russia talks about, yes, having a high infection rate. We've seen more than 10,000 cases every day in Russia for the past more than a week, in fact, now. So that's continuing to push up. But officials are now saying, don't look at the number. That's because the infection, that's because the testing rate here in Russia is very high. That's why we're detecting so many cases. So that's not important, they say. Look at how many people are in a serious condition in hospital, and they say that remains relatively low. They say that capacity in hospitals is okay, and that's why Russia can move gradually, slowly, very carefully to removing some of the restrictions that have been in place for 6 weeks now. But it is piecemeal. So here in Moscow, where the infection rate remains extremely high, there is a limited reversal of the lockdown. So construction companies are going back to work, some factories as a whole are going back to work, but not the service sector. But just outside Moscow, in the region, where the infection rate is even higher, even construction workers haven't gone back to work. So it's a little bit confused. People don't really understand quite what to make of it. They don't understand how, when the infection rate is so high and still climbing, they're being told to go back to work.
Well, also in Russia, a fire in a hospital in St. Petersburg has killed 5 people being treated for coronavirus in an intensive care unit. These are the pictures from the scene. Staff evacuated 15 patients from the ward, but they were unable to rescue 5 others who'd been hooked up to ventilators. It's believed the ventilators caused the fire. Here's Olga Ivshina from BBC Russian Service.
It's actually a second time in less than 7 days when a ventilator catches fire in hospital. The previous case happened in Moscow. Both ventilators, the one in Moscow and one in St. Petersburg, were produced at the same factory, which has already caused the discussion that maybe there are troubles with the machine itself. There is an alternative theory that there was some troubles with the electricity supply, but specialists agree that at the moment the pressure on healthcare system, including ventilators, is tremendous, and this could be one of the most possible versions why the ventilator caught fire in St. Petersburg, but the details are emerging.
Well, turning from Russia to India, where the Prime Minister Narendra Modi has announced an economic support package worth $270 billion to help mitigate the economic impact inflicted by the virus. So far, Modi has extended his country's lockdown twice, and today he hinted it would continue for even longer, although in a more relaxed form. Our correspondent, Divya Arya, is in Delhi.
We've seen really shocking stories of misery, deprivation, deaths due to hunger, and a lot of uncertainty in the last 50 days that the lockdown has been in place. It has been one of the strictest lockdowns, and there has been a huge demand by small industries, cottage industries, medium industries for help from the government. And this package is supposed to do just that. There were no further details forthcoming by the Prime Minister when he announced the big number, but he did say the focus of the package will, one, be to alleviate suffering, but the other to make India self-reliant and turn this crisis that the COVID-19 pandemic has thrown at us into an opportunity.
Well, also in India, the country has partially restarted its national rail network between the capital Delhi and other major cities. Online ticket sales have been limited to prevent overcrowding, and passengers must wear a mask and undergo screening. India's rail network, which usually transports about 20 million people a day, shut down in March. Here's Divya again.
The New Delhi railway station, which is generally bustling with thousands of passengers trying to get to their trains, today it's barely a trickle. 15 cities have today been connected with Delhi as passenger trains have been allowed to go out of this station. But strict measures for social distancing are in place. There are barricades, and passengers are allowed to enter the station only 90 minutes before the departure of their train. The country's rail network, amongst the largest in the world, transports around 20 million people each day, but was completely shut down almost 50 days back when a strict lockdown was imposed across the country. Now, when restrictions are being eased along with these passenger trains, special trains are also being run to take migrant workers who are stranded in the big cities back to their home states. But this relaxation comes at a time when India has seen a huge spike in numbers over the past week. Now, more than 70,000 people have tested positive of COVID, and almost 2,300 people have died.
Well, other news out of India, CO2 emissions have fallen for the first time in 4 decades, and not just as a result of the lockdown. According to analysts, falling electricity use and competition from renewables weakened the demand for fossil fuels even before the coronavirus hit. However, the sudden lockdown in March tipped India's 37-year emissions growth trend into reverse, with carbon dioxide emissions falling 15%. China is planning to test the entire population of Wuhan, 11 million people, after a cluster of new coronavirus cases there. The city was the original epicenter of the virus in January, and it's been gradually reopening over recent weeks. Officials want to test all residents within the next 10 days. OK, let's move to South Korea now, where more than 100 people have now tested positive for coronavirus linked to a nightclub district in Seoul. Police are working to track down other club goers, but it's thought many gave fake names and numbers at the door. Now, the government had started relaxing social distancing rules after extensive track and tracing brought down numbers. Here's Laura Bicker.
Now, 8,500 officers are involved in tracking down over 10,000 people they believe to have been in these various clubs on the dates in question. It was a holiday weekend. The area was entirely packed. This is Seoul's party district. And I realise that people around the world will be raising eyebrows and thinking, what on earth are people doing clubbing during a pandemic? The clubs were opened after April the 19th. You were allowed to go if you used hand sanitizer, wore a mask and wrote your name and contact number at the door. Now, things are complicated by the fact that a number of these clubs were used by the LGBTQ community. Now, when it comes to being LGBTQ in this country, it comes with a lot of discrimination. It can be extremely difficult to come out. It can mean losing your job, losing your family. And that is why health officials are now saying privacy is important. They're putting that at the forefront of their campaign. They're saying people can come forward without giving their names and they can be tested. So I think that is the kind of message that is going out on these emergency text alerts that we're getting hour by hour here in Seoul, urging us to go and get tested. And that's the message that officials are using when they're tracking these people down.
Well, staying in Asia, and Singapore is easing lockdown measures that have been in place since April. With more, here's Karishma Vaswani.
What we're seeing today is a small cluster of businesses being allowed to open. These are things like hairdressers for a simple haircut, no longer than an hour, for instance. You can go to the pet store now and even to the bakery to buy some desserts and cakes. But all of this is being extremely carefully controlled and managed. And the Singapore government has been relying on technology to ensure that the people who do go into these shops, go into the offices, they have to virtually check in and check out using an app called Safe Entry. And that's because the government wants to keep tabs on people in case there's a new cluster of infections.